This video is about the detailed footwork that feeds into our leg work. In the same way that hand massage is critical to upper body work, so too footwork is critical to the lower body work. We look at the questions of anatomy and physiology when we look at the pathology about specific conditions. It's worth at this point though refreshing your general anatomy and physiology of the foot and legs if it's something you haven't done for a while. And we'll look at some of the general contraindications when we're working on the feet and legs. You need this groundwork in order to treat a number of conditions that include sciatica, cramp, scoliosis, anything really that needs lower body work. We're going to start with the feet. The contraindications for foot and leg work. We're never massaging over or near varicose veins. You could damage a vein, it'll cause severe bleeding, and it will be a medical emergency. Never massage somebody who has a DVT. If you can see a leg, it's not always the calf, but it's usually the calf, which is swollen, red and hot, sometimes accompanied by pain or cramp. Assume that it could be a blood clot. Refer your client for immediate medical attention. This can be a life-threatening condition. Never massage over a joint or over an area that is swollen, deformed, hot, or where the skin is broken. Take extra care when working with a client with diabetes. Avoid the detailed footwork with somebody with advanced or poorly controlled diabetes. Avoid any footwork and refer for medical attention somebody who with diabetes whose foot has ulcers, black skin, or whose foot is very cold. Never work at the back of the knee. This area not only contains glands from the lymphatic system, but pain here is usually the result of an injury to ligament or cartilage, or it's a result of wear and tear such as osteoarthritis or rheumatoid arthritis. There might even be an infection, for example, from septic arthritis. Very rarely it might be some kind of growth or tumour. These are not things we would be looking to treat with massage. We can do a lot for the knees, but we do it by loosening up the areas around the knee, not the knee itself. Be careful with your draping and your hand position, especially as you work up the leg. Don't make your client feel uncomfortable, and don't leave yourself open to accusations or actions of a sexual nature. Never expose the groin area. It should always be covered by your draping, and never slide your hand underneath the draping towards the groin. We'll talk later about hand position as we do that practical work. Everybody needs to feel safe in your massage room and not wondering where that hand might be going next. Again, we'll talk through what we're going to do, and then I'll demonstrate it with a client model. Before you get your client on the table, start by looking at the feet with your client standing if they're able to, and then seated or laid down. You need to be asking yourself if both feet look the same and trying to assess if there's any obvious tension in the foot. To massage the foot in detail, have your client laid face down in a comfortable position. Ensure that you're also in a comfortable position, because you could be there for 30 minutes doing this footwork. You can place a pillow underneath the lower legs to take any pressure off the back, and there's also instructions in the book how to do this if your client's seated. Your aim is to give a therapeutic foot treatment, and it's to get rid of any residual tension that's held there. When the client is laid down or sat and the foot is relaxed, the toes should be fairly loose. You should be able to lift them with one finger without feeling much resistance. Toes should be reasonably straight. Many people by the time they get to adulthood will have some deformity in the feet where toes might not quite be straight. It might be due to an injury, ill-fitting shoes, bad postural habits. You're not aiming to correct any of those structural bending of the toes where the bend is a sideways joint. What you're looking for is to see if the toes either pull up or pull under as they do in the pictures shown in the book. This indicates residual tension in the foot. Part of the aim of your treatment is to try and reduce this pulling of the toes in either direction. As you're massaging, you're working on all the structure of the foot, muscles, fascia, connective tissue. So you need to start your work from where that tension will be embedded, at the very end of the toes. You don't need to worry about what it is you're working on, so long as you're not massaging over joints or bone. Your aim is to simply find areas that are tight, and by your massage, help it to release. It doesn't matter which toe you start with, but just work systematically so you cover all of the toes. It can be fiddly to work toes, so be patient. Some people will be very sensitive, be very careful with your pressure, work through a towel if they're ticklish or if they have really smelly feet. Only once you've worked each toe can you then move on to the rest of the foot. We'll demonstrate that in detail now. Only when you've treated the foot do you then go on to treat the rest of the leg. Remember, we always work both feet, even if the client is reporting a problem on one side. Let's look at this in practice now. I've drawn some lines on the client toes so that you can see where you're aiming to work. Now, we're going to work the foot in a very similar way to how we worked the hand. The big difference, I'm going to warm it up a little bit more. Again, it's just because of where we are in the world, in that it's in England and it's February and it's cold. So Margaret's feet are a little bit cold. So I'm just going to get them warm just by doing some kind of squeezing and pressing. I don't want to use oil just yet because then I will slip off the toes when we come back to the toe work. So I just want to encourage a little bit more circulation here into this foot. If you're working in a nice warm country or it's summer, you'll have to do a bit less of this. But we just want to get this foot a little warmed up first. And we always start with some warm-up work, so do some of this. You can see I'm just using the flat of my hand, or the heel of my hand rather, to get in and just start to soften the skin here. Feet are very different to work on than hands because obviously the skin is usually thicker. And if you think about what feet do in the day while our hands are doing all of that kind of fine dexterous work and lifting, our feet are actually supporting us and carrying us through the day. But they're also, this is a really big part of our balance mechanism. So we're adjusting, making micro adjustments in our movements every time we walk to keep balance. So once we've warmed up a little bit, we're then going to do that toe work. Now on the fingers, we could do it kind of knuckle by knuckle. It's harder to do that with the toes, but you can see I'm kind of looking at the toe as a whole, but I'm pressing in, I'm making small circles round, I'm moving up a little bit. As I say, no oil, because if you've got oil on here, you will just slip off. So this is the equivalent of the move that we did on the palm of the hand, the palm side of the fingers. It's harder to do the top. You're only really working below the first knuckle. And again, it's that press or release. If I show you on my hand again, it's this movement. This press, circle and release, press, circle and release. I'm going to show this more quickly than we did on the hands. But the feet, working the feet in detail is key to releasing tension in the knees, in the hips, in the sacrum, anywhere in the lower body. Sometimes in the upper body, sometimes foot tension can go all the way up to the head. So you can see I'm just going from toe to toe. There's no particular order that you have to work in. You can work any toe in turn. You could, in theory, work two toes at once, but it can be quite intensive work for your client. So I tend to just do one foot at a time. And you can see here, perhaps, I'll show you again on the little one. As I'm pressing on this line here, I'm also pressing underneath. So I'm kind of working at diagonals on the toe so that I can loosen the structures on both sides. You might find as you work, you just need to change hands. Keep it comfortable for you. You need to be comfortable in your work. The big toe is more fleshy, so you can kind of get into that a little bit more. And again, my main pressure is downwards. Here I'm working across the whole of the big toe, because this plays such an important part in balance and in our movement. I want to work those, the lines on the top of the toe as well. So it's just the equivalent of doing this across the thumb. Now, different people will have very different feet. If you're working with somebody who has maybe verrucas on their foot, just pop a plaster on it, or ask them to pop a plaster on it before they come for their treatment. You don't want to be touching a verruca and then moving on to a different part of their foot, or indeed on the leg. And for your own safety as well, you don't want to be picking up that verruca, so just cover it. If somebody's really ticklish, you can also work through socks, or quite often I will just work through a towel, and I'll do the work like this, but obviously you can't see it on camera if I'm doing it that way. You will get people who come in for treatments and they've come straight from work. They might have been on a building site all day. Their feet might not be particularly clean, particularly nice to work on. Peppermint oil is really good. If somebody's got very smelly feet, I just tend to put a few dots of peppermint oil around the foot. If they're coming back for a second treatment, I know, so I'll do it in advance. But I'll just keep that peppermint oil to hand, and it just covers the smell for you a little bit. We're starting to work up into the arch. There's much more detail on working into the arch on the video on plantar fasciitis, so you can refer to that video for the detail there. As you come up to the side of the foot, I will often use the heel of my hand here just to run across it. You might not be able to see that too well on the video, so I'm doing this but with the heel of my hand. It can feel actually quite nice for the client, although it might look a bit strange. If somebody's got very thick soles of the feet, the other thing you can do is to use your elbow in here. Obviously support the foot, so you're not just pushing the foot in. You can see in all of this I'm supporting the foot as I work. So you can use your elbow just to get into that kind of really meaty bit at the bottom of the toes. So we can work right into the heel now. We don't do this when we're doing plantar fasciitis, but we can here. Now, normally I would lift the foot and I'd stand to work the front of the foot, but I'm just going to ask Margaret if she could bring her leg out for me just so that I can show you the top of the foot. Thank you, Margaret. And I'm going to support the foot with a towel just so that Margaret doesn't have to kind of keep it up in the air. I'm going to use a little bit of lotion for the top of the foot, and just because the skin tends to be a little bit drier here, and you can see very clearly here where the toes are going. So I'm following up the side of my thumb, making sure there's no nail that will cause any damage, and I'm just working up in between the bones in exactly the same way as we worked up the hand. And then we're going to just change position while I can show you how we're going to work around the ankle. So having done that footwork, I'm just going to change position a little bit. You can also do a nice foot roll here. You can see it's the flat of my hand and I'm supporting Margaret's foot. I'm holding the foot up so that she doesn't have to. And I'm just rolling the foot between my hands. I'll lower that a little bit so you can see. And then we're going to come in just to check how the ankle is moving in exactly the same way as we checked how the wrist is moving. But to do this, you really need to support the foot. So I'm going to put one hand across Margaret's toes and my other hand on her heel so that I can control that movement. If you do it just with that hand, you can see the foot the leg goes everywhere. If you do it here, you don't get a natural movement because you're not controlling the foot. So it's two hands, one on the toes, one on the heel, and we're just looking for how is that rotation. Now obviously if somebody's had an ankle fusion surgery, you would miss this bit out. But what we're looking for is where there's any clunkiness. Now again, as with the hands and the wrist, Margaret's rotation there is quite smooth. If there was, say, clunkiness when we got to here, I would simply, I'd hold the foot back, I would press into that area and I would just move the foot backwards and forwards just to work into that ankle. And the same at the other side. So once we're happy with that ankle rotation, we're then going to move on to do some work on the calves. So having done that foot and ankle work, we're then going to come to do the work on the calf. I'm demonstrating here all of the back of the body work first, and then we'll do the front of the body work. I tend to do all of the back of the body work first, particularly when I'm maybe doing the legs, because it's kind of hard work for the client to have to change over just because you've got up to the knee and then change back again for the thigh. So we just do it all together. Now, before I use any oil, we can do some of that fascia release work. We cover this in much more detail when we do fibromyalgia, so I'll not repeat myself here. But we're just doing a very simple fascia release twist. You can't really do the roll here. There's not kind of enough surface area. And we're doing this before we add any oil. If I've added oil, you'll just slide. I'll show you in a minute when I've added the oil. So we're just quickly doing that fascia release across the whole of the back of the calf. I would normally do this a little more slowly, depending on the amount of time that the client's booked. I normally work for an hour with Margaret, but every third treatment we'll book an hour and a half so we can have extra time to work on the feet. And then I'm going to apply a little oil. Again, as we did with the arm, I'm going to apply a little bit more oil than I normally would do, just so that I don't have to keep going back to it. But you can see now, if I try and do that fascia release, it's almost impossible because my hands are just skidding across the skin. So we're going to do some nice warm-up work in the direction of the heart, always working towards the heart. And you start to pick up, as you're doing this, you'll start just under your hands, you'll start to feel areas that are more resistant than others. So for Margaret, it's here. It's up the outside. And that's the area then where that residual tension is. So that's what we need to really release. We can also do the cross-frictional work. We can do this as part of warm-up, and we can also do it as part of our deeper work. So I'll show you here as part of the warm-up. And once we've warmed up, we slow down because we're working a little deeper. And as you can see, I'm supporting Margaret's ankle with a towel just so that I'm not putting any pressure on the ankle joint. So if I move my second hand, what I'm doing here, I'm working the muscles generally, but you can see this finger is coming down much deeper. That's where the main kind of depth work is going. But in order to protect my own hands, because we need to protect ourselves as we work, I'm putting this hand on top to protect those knuckles. So my pressure is coming from both hands. It's coming from the finger, but mainly it's coming from this hand. And I'm getting the depth that I'm getting because I am moving my whole body. So this actual depth comes right from the legs. Be gentler on the inside of the calf. That will easily bruise and it will be painful. So we just pull back our depth a little bit there. You'll see in the plantar fasciitis video we do this deeper work into the belly of the calf. I'm going to do just a little bit of that here. And if Margaret had really bulky legs, if she was a bodybuilder maybe, and at the gym three times a week, a bit of a gym bunny, I could use my arm to do that. Now normally I would do this from the side to protect myself. I'm just showing you here how I would do it. It's working up the calf. So we can do the long strokes, we can do the cross-frictional work. You can support your thumb or your finger with the other hand to get deeper, and you can use your arm to get deeper as well. Now you do need to be careful when you're working on the calf that if anybody is susceptible to cramp, this is where they're likely to get it. If you're working too fast, this area will cramp. Some people, as soon as you touch it, it will cramp. So just pull back on your pressure and slow down We have a separate video on cramp that it's worth cross-referencing to for that as well. And finally, you can shake it out. Now I'm showing you this quite quickly. You could repeat this as many times as needed. What you're feeling for is that change in the muscle tone. So where you've got those areas of residual tension, you feel those going. Once those have gone, you can move on. There's another little one there, so I'll come back in and just hold it. It's releasing very quickly, so then I can move on. Always finish by kind of going back up with that stroking work up towards the heart. So now we're going to work the upper leg. You can see my draping here. I'm being really careful that I'm only exposing what I need to work on, and I'm not really exposing the inner thigh because I'm not going to work up there. It's very strange for your client if there's suddenly a hand coming up towards their inner thigh. But the area we really need to work is the area that's coming out up to just underneath the glutes. So this is just the warm-up work. Just move that a little bit so you can see more. You can do that cross-frictional work as well. Just be careful. You can see there as I can start with my hand like that, but as I'm coming further up, I'm tucking my fingers up. I'm tucking my fingers in just so that my hands aren't going into the inner thigh. We don't want to be accused of any inappropriate behaviour as we work, and just being conscious of where your hands are is part of that. So you can see I naturally progress then from warm up into deeper work, and if somebody's got really tight legs, you can spend longer on this. So I'm moving between, I can use my thumb, the kind of flat of thumb on my hand, I can use the flat of my knuckles, I can use the heel of my hand, and if somebody's got really particularly big legs, I'll also use the flat of my arm. Again, keeping my hand nice and relaxed as I'm working. Good place for that cross-frictional work. And you can use all of your normal techniques here as well. You know, whatever you normally do in your massage, add that in. This is just extra. Where you're feeling resistance, just pause. You see what I'm not doing? I'm not working on the very side of the leg. I'm not working the IT band. There's a lot of discussion around the IT band really, and whether it should be tight, shouldn't be tight. The kind of current wisdom is that heading towards anyway, that it's actually more of a fascial connective structure. What it's made of depends who you speak to, but that actually it's a stabilising structure between the hip and the knee. If you come in, you just work it, you'll find people will just have a string of bruises up here, whereas if you release the back of the leg and the front of the leg, you'll release any additional tension that shouldn't be there into the IT band. And then one other really nice move just to show you, by lifting the leg, I'm avoiding the knee, I'm placing my arm just above the knee so that I'm kind of holding the muscle down and restricting the muscle, and I'm going to just raise and lift, or drop and lift Margaret's leg, and do that 2 or 3 times, and then going to move up 3 or 4 centimetres, 1.5 inches, 2 inches if you work in inches, each time. This is a really effective way of releasing the muscle. Because I'm restricting the muscle and moving it, I'm using the muscle's own movement to actually get that release, which makes it easier for the client and easier for me. And then we're going to move on to the front of the leg. So then we move to work on the front of the leg. We're supporting the knee with a pillow, or you can use a roll-up blanket or towel, but we just want to take any pressure off that knee. You can do the same fascia release techniques here. We've shown them elsewhere, so I'm just going to move straight on into warming up. So I'm going to use a little bit of oil here. Bottom of the legs tend to get a bit dry, so you might need extra oil. And if you're working on a client who's really hairy, you will use a lot more oil because the hair just absorbs the oil. So expect that when you're working on men, you'll probably use more oil than when you're working on women. You can see we're just warming up. I'm being very careful with my pressure on the inner calf for the same reason as when we were working with the client face down. And I can use that cross-frictional work. So I'm working on the outside of the shin. There's more detail in this on the video on shin splints that you can always cross-reference to. My main work here was with my right hand. You can probably see that's working a little bit deeper. So I'm kind of warming up with the left and then I'm treating with the right, and then I'm going to just do some deeper work. Up here, just checking in visually with Margaret that that's not too much. I can use the flat of my hand. If somebody's really tight here, you could use the flat of your arm, but it's not necessary on this occasion. And you can spend as long as you need on here. So we're just going to spend a couple of minutes, but you could spend 10 minutes. If it's tight, just keep going back and repeating the same things, in addition, of course, to all of your usual moves. Where you find a particularly tight spot, make use of that static hold, where you're just holding the spot for 30 seconds, a minute. When it releases, you move on. What I tend to do is after I've used static hold and released it, I'll come back and I'll give kind of a work up the muscle, the full length of the muscle, just to ease it out a little bit. We're then missing the knee. We're not working over the knee itself. Always warming the oil in our own hands, never direct to the client. And again, you can see by my draping where I'm going to be working. So I'm going under the draping a little bit out towards the hip, but only with my fingers out. And you can see the hand position is important here. If I'm working this way, then my client's thinking, where are those fingers going? If I'm working this way, it takes a little bit of practice, but there's no kind of doubt in the client's mind as to where my fingers are going. So I'm warming up the whole of the leg, and I'm coming again along the outside, but I'm not working directly onto that IT band. This is a little bit challenging for Margaret, so she is rightly just adjusting her breathing, and she's breathing a little bit deeper into that tension. Where it's particularly challenging, again, just press and hold. Because this is quite a large muscle, you can't really just press with the point of a thumb as we have with other muscles. So you can either use the flat of a thumb, support it if you need to so that you don't put pressure on your thumb. You can use the flat of your knuckles. Just be careful here that you are very much flat of knuckles and there's no pointy bits of knuckles sticking individually. That's when it's likely to bruise. So just that static hold. You can also rock the leg, so you can hold it and just introduce movement while you're restricting the muscle, just as we did with that movement when Margaret was face down and we were lifting the knee up and down. Here we're just doing a similar thing, that we're restricting the muscle and we're just rocking the leg. And you can also, I'm not going to press too hard here because Margaret's a little tight here and we'd need to do a bit more work here first. You can just rest on, and you can either move up slowly kind of centimetre by centimetre, or you can sweep up. Again, I'm not going to apply much pressure here because Margaret's tight here and she needs a little bit more work first. But particularly people who are using their legs a lot in their occupation, people are up and down ladders all the time, you'll find that this is very, very tight. And this is where that static hold really comes into its own. So you can turn the leg out, put the pressure on and just wait. Sometimes when you hold it, you can feel the muscle underneath almost kind of starts to vibrate like that under your hand. And that's as it's starting to release. So just hang there, stay there. And you'll find it will suddenly kind of soften. It's like squishing a piece of fruit where it suddenly goes. And then as ever, when we've used the static hold, we stroke all the way out. Now I'm coming right up just to the bottom of the hips, because then we're going to pick up the other muscles there when we're face down doing the hip work.